Hello, I'm Rich Petersen. As a healthcare community, we strive always to deliver excellent care centered on our patients and their families. One of the most powerful ways to do so is clarifying the wishes of patients as they prepare for the end of life and then respecting their choices. The video presentation which follows will introduce you to some of the concepts and tools used to support patients through this important phase of life. Dr. Jim Wasserman is a nephrologist who has practiced in Maine over 20 years. Excellent care at the end of life has become central to his practice.
I was first attracted to nephrology not really for patient care or advanced care planning, but I was really a math and science kid. Initially, I liked to apply all the science I knew, all the math I knew, to helping to get patients better. But I then came to realize that I didn't think it was about the math anymore. It wasn't about the science, but it was more about developing important relationships with patients, particularly the patients that I was serving. And the patients that I'm serving are people who have chronic illness. And I subsequently went on a course where I did different efforts and different methods to have people try to live well with chronic illness, whether that be exercise, eating right, alternative practices such as meditation, with the idea being to have people be as independent as they could, because I tend to define health as being independent. But one area of the practice, or one area of my practice that I neglected, was empowering people to be independent all the way through their life, and I mean to the very end. It was a program where it was made known to the population participated in it, and then when the advanced care planning was needed, it was accessible to the caregivers under emergent and non-emergent situations. And they've gone on to publish all their data showing how this is not only a great benefit to people's lives there, but it's also a great benefit to the healthcare systems in many different ways. And after speaking to people, I said, well, why can't we do this here? So with the help of the ethics committee, with Kitty Garland, we started to do some projects with this, and specifically for me, I started to do it in the dialysis clinic where I work. So that when people come to the dialysis clinic, one of the first things we do is we have a sit down with them. We find out if they've done advanced care planning, if they even know what advanced care planning is, and if not, to begin an education process and begin the process of advanced care planning there. And since that time, 2 or 3 years ago, about 80% of the people in the dialysis clinic where I work now have had discussions about advanced care planning. And with these discussions, it has gotten back to where people are independent and empowered, not only on the part of their life where they're more well or doing well, but also the part of their life where they're becoming sick and might not be able to speak for themselves. And it's been a great thing not only for patients, but patients' families, because it not only empowers patients, but it lets patients and families sit down together and say to each other what they want, what's meaningful in their life, and how they can best achieve this meaning, not only when they're well, but also when they get sick. It's been an important bonding process for patients and families, and also for patients, families, and myself. And it's really added to my practice as a physician, and I think what I'm able to offer people as they move through chronic kidney disease and into dialysis, into places where they're not well any longer.
My mother was just a great person. She did love life and she loved her family. She loved Elvis and most importantly her grandchildren and her children.
I got to know Miss Newman and her family very well, as her family always came on her visits too. And at one point Miss Newman didn't have enough kidney function to allow her to be who she was or to do the things that were meaningful for her. And although she had told me that she would never, ever, ever get renal replacement therapy, the point came where after many discussions she came to the realization that she still had a lot of things that she wanted to live for.
During the 4 years that she was on dialysis, she would have bouts of energy, she would take trips, she got to enjoy grandchildren that were, 2 additional grandchildren that were born during that time. A lot of time with her family, with all of her children and her grandchildren. But once she had that decline from the heart surgery, everything else started shutting down. We saw the deterioration. We saw that things weren't working. We saw her trying to go to dialysis every day and still not having the results that she needed.
And at one point she finally said, "This isn't worth it to me anymore." It wasn't a shock to myself or her daughter or the rest of her family, because this is something we had talked about for a long time. Is this meaningful for you? Does this allow you to do who you want? Does this allow you to be Mrs. Newman? And at one point I think she just didn't feel like she was Mrs. Newman anymore, or what used to matter to her so much just didn't matter to her anymore. So we then had conversations, again another sit down with the social workers, myself, nurses, for quite a period of time, and saying, what can we do? What do you want out of the healthcare system, and what can we do to make you well as you can be? And she said, well, I'm just ready to stop, and there's nothing you can do to help me anymore. I'm tired, and I'm ready to stop now.
Of course, it's like a little bit of getting kicked in the gut when you hear something that you know to be true and factual, but now it's right there and you can't ignore it anymore. So it was hard, and I took a deep breath, but I knew it. It wasn't a surprise. It was not a surprise. Once her decision was acknowledged and, we knew where it was going anyway, everything was just so love-filled, and it was just the most beautiful, compassionate experience. We played a lot of Scrabble, and it was very interesting that her mind worked right up until the end, because she taught me how to play Scrabble. I'm very hard to beat. We got the most out of the last few days or few weeks with my mother, and I think she got the most too. She had an amazing support system from everyone from her clinic. Was so kind, so caring, so wonderful, and she used to joke around that her primary doctor there, he's like, he treats me like I'm his mother. Who can sit here who truly loved a parent so much and sit with a giant smile and talk about their death? I never thought I'd be able to. It was just, again, I can never from the bottom of my heart thank the care team that made that happen.